Imagine a world where we turn a blind eye to the invisible threats lurking in our food. That's the reality we're inching closer to with the recent decision by the Centers for Disease Control and Prevention, CDC, to scale back its foodborne diseases active surveillance network, FoodNet. Here's where it gets controversial. Is this a necessary cost-cutting measure or a dangerous gamble with public health? Let's dive in. As of July 1st, FoodNet, a collaborative effort involving the CDC, the Food and Drug Administration, the U.S. Department of Agriculture, and 10 state health departments, has narrowed its focus to just two pathogens, Salmonella and Shiga toxin-producing Escherichia coli, STEC. This means that tracking illnesses caused by other dangerous pathogens like Campylobacter, Cyclospora, Listeria, Shigella, Vibrio, and Yersinia is now optional, according to the Department of Health and Human Services, HHS. This shift was first reported by NBC News, which cited reduced federal funding as the driving force behind the change. FoodNet operates in Colorado, Connecticut, Georgia, Maryland, Minnesota, New Mexico, Oregon, Tennessee, and select counties in California and New York. While some states, like Minnesota and Maryland, have assured continued monitoring of all 8 pathogens under their own infectious disease reporting rules, others, such as Colorado, may struggle to maintain comprehensive surveillance. And this is the part most people miss: the potential ripple effects of these cutbacks on our ability to detect and respond to foodborne outbreaks. In an email to CIDRAT News, an HHS spokesperson justified the change by emphasizing that Salmonella and STEC are among the top contributors to foodborne illnesses, hospitalizations, and deaths in the U.S. They also noted that other CDC systems track the remaining pathogens, and that narrowing FoodNet's focus will allow its staff to prioritize core activities. But is this enough to offset the risks? FoodNet, established in 1995 in response to the 1992-93 E. coli 0157H7 outbreak linked to Jack in the Box hamburgers, has been a cornerstone of population-based surveillance. Craig Hedberg, Ph.D., a professor at the University of Minnesota, explains that FoodNet was designed to actively monitor 7, later 8, foodborne pathogens commonly diagnosed by clinical laboratories in its catchment areas. This system ensured that all diagnosed cases were reported, providing a critical early warning system for outbreaks. Foodborne illnesses are a staggering public health challenge in the U.S. The CDC estimates that 48 million Americans fall ill each year, with 128,000 hospitalizations and 3,000 deaths. While Salmonella and STEC are major culprits, pathogens like Campylobacter and Listeria monocytogenes are also significant threats. For instance, Campylobacter sickens 1.5 million Americans annually, and Listeria is the third leading cause of foodborne illness deaths. Whoa! Here's the unsettling truth. Scaling back FoodNet sends a troubling message that foodborne disease surveillance is a luxury we can't afford. Gail Hansen, DVM MPH, a public health and veterinary consultant, warns that reduced surveillance could delay outbreak detection, allowing illnesses to spread unchecked. The beauty of FoodNet was its ability to collect and coordinate data across states, providing rapid alerts, she notes. Without it, we risk returning to a fragmented system where outbreaks slip through the cracks. Hedberg echoes this concern, arguing that FoodNet is the foundation of our food safety system. While other CDC programs like PulseNet and FoodCorps focus on outbreak detection and investigation, they rely on robust surveillance data. Cutting FoodNet undermines the entire system, he warns. It's not just about saving money, it's about safeguarding lives. Recent outbreaks underscore the stakes. A 2024 listeriosis outbreak linked to Boar's Head deli meat sickened at least 61 people across 19 states and caused 10 suspected deaths. Another Listeria outbreak tied to pre-cooked meals resulted in 17 illnesses and 3 deaths. With Listeria no longer a priority for FoodNet, such outbreaks could go undetected for longer, putting more lives at risk. Now here's the question that should keep us up at night. Are we willing to trade short-term savings for long-term public health risks? The decision to scale back FoodNet may seem pragmatic. but it could leave us dangerously unprepared for the next foodborne crisis. What do you think? Is this a necessary adjustment or a reckless gamble? Share your thoughts in the comments. Let's keep this critical conversation going.